having a life scholarship and being able to afford to go to college made me feel inspired to go.
When I got a life scholarship, it was such a relief.
I knew that I wanted to have an impact. Having a life scholarship through the SC Education Lottery was huge. It gave me the opportunity to make that impact right here at home.
The South Carolina Education Lottery. A better you, a better us, a better South Carolina. Visit sceducationlottery.com/betteryou.
Ready to make a real impact every day? Join the Active Day Home Care team and help clients maintain their independence in the comfort of their own homes. Make a difference in someone's life as you provide essential daily assistance and protect their health and happiness. Earn up to $20 an hour and enjoy additional perks like optional daily pay, 401k, paid time off, ongoing educational training, and more. Join a team that values care, compassion, and your professional growth. Visit activeday.com to apply.
What's up, everybody? You are listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker, and I have on the show today Dr. Asher Roberts, who is one of our 2 sports residents this year at Rehab to Perform, and he just wrapped up his February research article review on the spine. And it looks like the article he chose has to do with testing strength and power and how that relates to somebody's performance in sport. And I'm glad that he picked this one because I've been practicing for 13 years now, and this is an area of return to sport testing or just return to sport readiness and preparation that I feel has always been a little bit more vague and a little bit more ambiguous than when you have a shoulder injury or a knee injury or an ankle injury, where there tends to be a very descriptive protocol to follow or very well-researched testing guidelines. And we have a variety of tests that we can use for the core, but because of the differences of injuries, the variety of injuries, and honestly just the multifactorial nature of what influences low back injuries, there's not really a consensus on what needs to be done and what should be done. So it leaves a lot open to interpretation. So, Asher, I'm curious to find out what you found in this article, but talk to us first. Just give us the title of the article you found and then the general premise behind it.
Yeah, so the article is called Strength and Power Related Measures in Assessing Core Muscle Performance in Sport and Rehabilitation. Now, this was a scoping review, so kind of like a watered-down meta-analysis, if you will. But they went over a ton of articles, well over 100. Goal with this was just finding any kind of new core tests that I could maybe incorporate with some of my patients in the clinic. You know, I've got a couple of like low back injured athletes, and you know, we do the kind of the standard core testing. But I wanted to see, hey, is there anything out there? Maybe it's a little less researched that I could use to incorporate in my return to sport testing.
Awesome. Now, getting into the actual article, what did they actually do? What did they choose to look at? Was there any specific tests that they highlighted, or when they came across the different articles, was there any consistency there? What did they actually find or focus on?
So there was a ton of information that they found. They kind of blocked it into a few big categories. They looked at assessing muscle strength and power, or core muscle strength and power during lifting tasks, during trunk rotation, and then just general core muscle strength and power assessment in sport and rehab. Not exactly the most organized article, admittedly, but there was some interesting findings in there.
Cool. So let's go by kind of category by category. When we're looking at muscle strength and power during lifting tasks, what did they find as meaningful there?
So they had a lot of very interesting topics on like, oh, if you're doing these core tests, you should do them at these different hip angles and knee angles, but didn't really delve into what those tests look like. They did mention things like doing like an isometric mid-thigh pull, and you want to make that position of that mid-thigh pull specific to the movement you're trying to test. If you're doing a clean, what's the normal like knee and hip angle there? You should be testing out those angles, those kind of things. The interesting thing in that lifting tasks category that they talked about was utilizing a deadlift to high pull at 70% of your 1 rep max as a test to determine core power.
Very interesting.
Very interesting.
I hope I never have to do that as a test for my core power, because I don't think it'll come back very flattering.
Oh, yeah, no. The idea with it was like you're standing on force plates and you're measuring basically RFD. And theoretically, measuring that RFD, if you have a weak core, you're going to lose some of that RFD as you get into that high pull because you're losing energy on that kinetic chain movement. So you can track that RFD, keeping weight the same, to kind of see how efficient they are with that pull. And theoretically, that's giving you an idea of core stability during a power-based movement. The interesting thing with this is not every athlete knows how to do a deadlift to high pull. So you're going to have a ton of variance across skill levels, all that kind of stuff. So really, like, could this be a good test? Maybe, but probably only with someone who's doing Olympic lifts, someone who has that kind of experience already.
Makes sense. And for those listening, if you're unfamiliar with RFD, rate of force development, so very important in core and really any strength and power assessments, we need to know the magnitude of force that somebody can develop, but also how quickly they can tap into that. So that's what that RFD looks at. Now, going into the next category, Asher, we talk about like assessing strength and power during trunk rotational movements. What did they find here?
Yeah, so this one was kind of funny. They the first big point that they brought up was that there's a poor correlation between the Behring-Sorensen test and rotational power, which, fair enough, you're not assessing rotational power during a Behring-Sorensen test. Yeah. The thing that they looked at, their like big topic that they went over in this literature review, was basically they had athletes sitting with a barbell on their back hooked up to an isoinertial dynamometer, and they just had them perform a max effort trunk rotation seated with a barbell on their back and measured kind of rate of force development again, and then just peak power. So kind of an interesting test there. They said that there was pretty good correlation between those results and sport performance. But those are pretty sensitive pieces of equipment and pretty expensive, hard to get your hands on. The biggest crossover I can see taking this into a clinic would be if you have something like a Kaiser, something where you'll do a movement on a Kaiser and it'll spit out a number of your peak power.
Yep.
Theoretically, you could mimic a setup similar to this, maybe where you're doing a seated pal-off press position and just rotating at max force. It might be hard to standardize, but it could give you an idea of just seated trunk rotational power, and you could get a number that you can track. Now, the carryover between clinics and stuff like that is going to be tricky because not every clinic has a Kaiser. So the actual utilization of this is kind of iffy depending on where you're working.
Yeah. I do think the nice thing about that, though, is it is something that is self-governed. So they can go as maximal voluntary effort as they wish. Mm-hmm. And it does give you some sort of quantification to it as well. And you had mentioned there's ways that make it challenging from a repeatability standpoint or a standardization standpoint. But again, it's better than nothing. Mm-hmm. And it is something that we have. Now, when we get into the next category, core, muscle strength, and power assessment in sport and rehab, what did they look at there? What did they find as meaningful?
Yeah, so kind of just three, maybe not so groundbreaking findings. They said that McGill core testing and the double leg lowering test were correlated with different athletic performance tests, specifically T-test, 40-yard dash, vertical jump. So nothing too crazy there. That more core stability is going to allow for better force translation, better stability during running tasks, change of direction tasks, things like that. They also found that Oswestry Disability Index scores inversely correlate with core flexor isokinetic strength. So stronger those core flexors are, the lower your ODI score is going to be. And then just kind of expected findings. They were like, if you train core rotation, you're going to get faster ball speed in tennis and faster ball speed in golf, which all makes sense.
Yep. And sometimes that is, when you read these articles and you find things that aren't necessarily novel findings, mm-hmm. it's still beneficial and it's still valuable because it's affirmation that what you have been doing already in your program design is continuing to show relevance. Mm-hmm. So it's always fun and exciting when you get a new finding, when you have something that's going to kind of reshape your lens or your focus. It's also equally comforting when you continue to get studies that affirm you are already doing things well and you're on the right path.
Definitely. And I think it also speaks to the fact that sometimes doing the basics can result in a good translation over to sport. You know, if an athlete can't do a plank for very long, do I probably want them going back to heavy change of direction? Yeah, maybe not. Maybe I want to coach that plank a little bit more.
And then as they went through this scoping review, they did find just some general gaps in what the current studies are that are out there. Rattle off just a couple of the bullet points they have there.
Yeah, I mean, the big thing is kind of what you alluded to earlier. There is a overall lack of like a standard battery of tests with core, strength, power, and stability. For how involved the core is across a variety of sports and a variety of movements, we don't have a lot of sound research that is like, hey, these are the tests you should be doing for these different sports. Let's see. That was probably the biggest one there. The other thing was like there is kind of that ambiguous relationship between specific tests and sport performance. So the best thing you can probably do is just put the athlete in a sport-specific situation where they're having to use their core and just test them in their efficiency in that position.
Perfect. As a PT in an outpatient sports medicine environment, we are in a community-facing clinic. We are an insurance-based clinic. So you see a little bit of everything. You get some youth athletes, you get some high school, you get some college, you get your recreational adults, and you get your older population that is just active in general. What are some things that you, as a clinician, try to keep in mind or implement when you're looking at assessing core strength and core power? And it's kind of a loaded question because this is across such a broad spectrum. But how do you personally organize your thoughts and figure out what's meaningful and what's relevant to look at?
I think the biggest thing is just trying to figure out what task is the person trying to get back to. We recently gave a lecture to a DPT program where we were talking pretty heavily about finding what is your athlete's terminal task and then what tests can you perform that are specific to those tasks. With someone who's more of an active adult who's having some back pain when they're picking up different heavy objects, maybe I'm looking at more of like just your standard McGill testing or a Behring Sorensen if they can tolerate it. Positions where we're looking at just general bracing and seeing how they perform in those tests. Whereas when I've had athletes who are, say, lacrosse athletes coming back from a low back spondy, something that's going to be a bit harder to bounce back from, where you need different core demands. Maybe there I'm looking at more of those rotational characteristics, and it might be a bit more subjective, where I'm looking more at kind of what their movement quality is, but still having something to track and assess with them doing sport-specific movements.
And I think with all of these, it's just your checklist that you go through and making sure we knock off everything from just your traditional orthopedic testing, all the stuff that you learn in PT school. Are they able to pass your basic foundational range of motion, strength, and table testing? And then if they're able to do that, then you start using clinical judgment in the scenarios that you just mentioned, where we start to map out what is this terminal task, what are the physical and positional demands that it entails, and how do we create a rehab program that we can reverse engineer from there. We start basic and we progressively work up to that terminal task. And then depending on the level of competition that they're returning to, and kind of how high the stakes are, that's probably going to guide how far down the rabbit hole you need to go to from objective testing, formal testing versus just informal progression of exercises, monitoring form, monitoring tolerance, and making sure the demands in rehab are mimicking or at least prefacing them for the demands that they're going to return to recreationally, occupationally, whatever that entails.
Definitely.
Asher, appreciate you doing the dirty work and getting this out for us. For those who are listening, if you enjoyed this episode, please share, like, and subscribe. You're listening to the Strength and Knowledge Podcast. Thanks for listening.
Having a life scholarship and being able to afford to go to college made me feel inspired to go.
When I got a life scholarship, it was such a relief.
I knew that I wanted to have an impact. Having a life scholarship through the SC Education Lottery was huge. It gave me the opportunity to make that impact right here at home.
The South Carolina Education Lottery. A better you, a better us, a better South Carolina. Visit seducationlottery.com/betteryou.